Welcome, everybody. Welcome. Excited to be here. Whoa, there's a lot of people popping on. It's nice to have everybody on here. Goodness gracious. Hi, Angela. Nice to have you on. Beverly, nice to have you on as well. And Eva. All right. God, I'm excited to be here today to deliver this unique and extraordinary information about hypothyroidism. As we're waiting for more people to pop on. Hey, hi, Debbie. Nice to have you on as well. All right, Nikki, nice to have you on. Get comfortable, turn up the volume, get your ears primed, because we're going to talk about how you can literally reverse the symptoms of hypothyroidism. Oh, hi, Patricia. Nice to have you on. How you could feel better, how you could think clear, how you can get energy back. Most importantly, how you can return from a life from fear and worry to a life of just hope and confidence. Now, not everybody pops on at the same time, but oh, hi, Kathleen. Nice to have you on. All right, Gracie, thank you. All right, so as we're going through this, I'm going to start off with the chat box. So, hey, you're going to be receiving some chat information from my staff. They're just going to confirm information, your contact information. Sometimes we have bad information, so my administrative staff will help you with that. So they'll just answer them if you can. This is a way, the chat box is a way for you if you're having difficulty, if you're having some challenges, you can always put inside that chat box, I can't hear, I can't see, and my staff will help you with that. Also, you can chat with everybody. If you'd like to, you can address everybody. I just ask if you're going to do that, please make sure it's positive. There's enough negativity in this world, but we do encourage comments, we do encourage questions, we love participation. Awesome, my goodness. Hi, Francis, nice to have you on. My goodness, there's a lot of people. Linda, Laura, nice to have you guys on. All right, good. So, in that chat section, I'm going to try that really quick. If you could do, in the chat section, there's an area where you can raise your hands. So this is just like if you can't get a hold of somebody in the chat, just like in a classroom, you'd raise your hand. And the teacher, it's the same thing here. You push that button, raise your hand, and what will happen is it will alert my staff, and you will get priority information or attention. Okay, so let's just try that. Can you just raise your hand for me so I know that you know how to do that? Sometimes people get, thank you, 1, 2, 3, thank you so much. Who is that? I appreciate that. Thank you, Debbie and Beverly and Jenny, Anna, Melody. My gosh, thank you so much. I appreciate it. All right, good. So this is a way you can just get attention from my staff. They see that your hand is raised, it alerts them, and they know you need attention. Okay, good. I'm gonna lower everybody's hands at this point. So we're gonna lower, perfect. All right, last thing is, if you could do, actually last thing, in that chat box, which you're probably getting information right now, could you do me a favor and just type in there, I can hear you, I can see you. Thank you. Is that Brandalee? I like that. Thank you. Blessings to everybody. All right, cool. Can you say, I can hear you? Thank you, Jenny. Thank you, Beverly. I appreciate that. At least I know that I'm not talking to dead air. Angela, thank you, Laura. Appreciate it. All right, cool. Oh, the last thing. At the very bottom, you'll see a Q&A. Okay, now that's for me. So if during this time something is not clear, it doesn't make sense, you have some, if I don't answer certain questions, type in the questions in there. And at the end, I'm going to spend some time personally going through those questions and answering them for you. And we can go back and forth. It's because it's live, which is kind of awesome at times. Please don't put any personal information about you, about your situation, because I can't answer a case history, but I can answer just general questions, okay? And so I will do that at the end, and we'll go through everything at that point. All right, good. All right, well, looks like we're all loaded up here. Excellent, thank you so much. I'm gonna make these all minimized. All right, so let's just get started. So welcome. First, I want to commend you guys for showing up. All right, I know it can be uncomfortable. I know it can be sometimes scary, reaching out for something new, reaching out for something that's gonna make a difference in your health, but it tells me a lot about where you put your health. How you value your health, and hopefully you're not going to take no for an answer when it comes to getting better, or you're just not going to settle for the results that you've been getting up to this point. Now, if you're on this webinar, you have likely been diagnosed with hypothyroidism, and in that most cases, most of you are needlessly I said that, needlessly suffering from so many low thyroid symptoms. And I can tell you, it can be scary. It can be debilitating. I know that. I think most of all, it's kind of frustrating to continue to deal with these symptoms and not really being offered any help or any type of hope for the future. What I want to do before I jump in, I want to start with something that's kind of cute and fun. So I'm going to share my screen with you really quick here. And let's see if I can get that shared real easily. All right, good. Let's start from that slide here. So let me ask you, how many of you, with a show of hands, are tired of feeling like this? Just one, two, really. I know, this is like morning coffee, need that coffee, right? All right, how many of you are tired of feeling like this? Or feeling like this inside, right? Or how many of your husbands or wives are tired of you acting like this, right? And it's like a horrible feeling. How about this feeling? How many of you guys are tired of this? Yeah, it's an awful feeling having that. I've watched that with my wife. She didn't like it. She didn't like it at all. And let's see, the last thing is, how many of you guys are tired of this poor little, feeling like this poor baby, wanting just to fall over and go to sleep? Well, I'll tell you this, I'm here to tell you that this no longer has to happen. You don't have to feel like this. I know you've probably been to practitioner after practitioner, you've gone to all these different doctors, and they told you that there's nothing that they can do. They just keep prescribing medication after medication. They look at you like you're crazy, like you're a hypochondriac. I see this every day. I've seen this happen in my own family, and that this does not have to happen. If you really understand what's really going on underneath the surface, these symptoms related to low thyroid are absolutely reversible, okay? Excuse me, let me get out of this. It's so darn cute. All right, so excellent. So let's just kind of dive in here, and I'm going to tell you really how that can happen. I'm going to tell you, how is it that you can really reverse low thyroid symptoms? How can you get to the point where you don't have to worry or feel these symptoms? I'm going to tell you how you're going to accomplish that. I'm also going to give you just the reasons why. I'm going to give you the information, Riley, that you're missing. If you're still suffering with low thyroid symptoms and you're on one drug after another, and you don't have any answers, well, then you're just definitely missing this information. And not having this information is possibly putting you at greater risk for other health issues that you don't even know about, but we'll talk a little bit more in a bit. So who am I? Who is this crazy doctor sitting here telling you that you probably don't have to be dealing with the symptoms, which is probably the opposite of what most doctors have told you? My name is Dr. Forrest Hannon. I've been in practice for over 28 years. I've taken care of over 10,000 patients. I know what we do works. And I've been dealing and working with people with low thyroid and diabetes probably almost 10 years now, and I haven't looked back. More importantly, I've seen hypothyroid happen in my own family. My wife suffered with so many low thyroid symptoms for so many years of, hair loss, exhaustion, weight gain, mood swings, depression, anxiety, constipation, heart palpitations, the whole gamut, okay? Actually, my wife, I don't want to go deep into her story, but I know that her story resonates with many women. She started gaining weight, no reason, no rhyme, no reason, didn't change her way she was eating. She started losing her hair, the drain started clogging up, her hairbrush was filling up with hair. She started getting constipation, she started being angry. Not the woman I married. My wife is the sweetest thing you would ever meet in your life, and she just started getting angry and snappy. I remember my kids, when I would come home, I have 5 kids, and they would come home to the door when I walked in and said, "Watch out, Mom's angry." And you'd walk in and she was storming through the house, throwing things. And then I would walk in and look at her and I say, "What's going on?" And instantly she would break down crying because she didn't know what was going on. I remember one time I came home and the kids were downstairs and Mom was nowhere to be found. And she was upstairs in bed in a fetal position crying in the dark. And I'm like, what's going on? She goes, I don't know what's wrong with me. I just I don't feel like myself. Something's wrong. We went to the doctor time and time to figure out what's going on. They had no clue. Finally, one day she was sitting, watching TV, and she's thinking to herself, my heart feels like it's slowing down. And all of a sudden she starts feeling herself falling forward and falling forward. And next thing you know, she falls into her lap and she comes back, oh, what's going on? She scared her to death. We went to the doctor, found out that she had hypothyroidism. So we dealt with these symptoms for so long, but doctor after doctor told her that she just needed to exercise more. She needed to eat less, which I just don't know how she could have eaten less. And I think probably most of you are doing the same way. And there was really nothing else they could do for her, okay? So for me, I had to figure out why she was having these issues. That's number one, she was miserable. She needed to be helped. And that's the thing I wanted. And additional, we just weren't going to take their answers as truth. We both knew there had to be a better way. And I think second, and probably most important, is once we figured out what we were doing with my wife and how we got that figured out, we knew we had to get this information out to the many women out there, some men, but many women out there who suffer with the exact same thing, but really you don't have to. See, your body gives you symptoms as a signal or a sign that something is not right. So it's using your body and understanding where these symptoms are coming from that leads you to where they're being caused by or what's causing them so that you can get resolution. So in my opinion, medicating every symptom that comes up is not resolving the true cause. And so, or why you're having the symptoms in the first place. So, certainly there is a time and a place for medications, but when we're dealing with, chronic diseases, when we're dealing with autoimmune diseases, when we're dealing with other diseases and the symptoms continue to mount and the drugs are not giving us resolution, we really have to look deeper, okay? And so, again, we just weren't going to take the answer, well, you're going to have to take these drugs for the rest of your life. But you really should, and you can and should demand that you get resolution of these symptoms because these symptoms are not normal and you're not crazy. So for me, since I figured this out, I've been able to help thousands of women resolve their issues. And it's my mission to get this information out to as many people as possible who are suffering with the symptoms, just like my wife, but you don't have to, okay? So when we're talking about this story of hypothyroidism and the hypothyroid patient, unfortunately, the story is the same for almost every one of you, and especially the ones I come in contact with. And you typically get diagnosed in two different phases in life. You get diagnosed when you start going through puberty or menstruation, or at least you're starting to have symptoms, right? And maybe it won't even be diagnosed that early. So your menstrual cycles are off, you're having anxiety, you're having depression, you're gaining weight. And a lot of times it's not even uncovered during that time. A colleague of mine was telling me of one of her patient's daughters who was having some issues with depression and anxiety. And they were going to put her on psychotropic drugs at 13 years old. And so my colleague's patient said, could you check her out to see if there's anything else going wrong? So they did some testing and found out that she was having some major thyroid issues at that point. And funny, just a week or two later, she started her menstrual cycle. So it can either turn on during menstruation when you start to become a woman, and you may not even notice it, but you may not even notice that you're having a problem. But typically after the birth of a child is typically when you will start to really notice the symptoms occur. And that's when most people start noticing it. So after the birth of a child, a lot of things could be going on that would be similar, or it would give you similar symptoms to thyroid problems like postpartum depression or the inability to lose weight or being tired a lot of times. And I would say a lot of times it just gets brushed off because, they'll say, of course you feel that way, you just had a baby. But a lot of times what's really going on is the thyroid is going crazy at that time. Now, it may not even be picked up at that time, even though there is thyroid dysfunction and there is imbalance in your thyroid, but many times it gets picked up sometimes 5, maybe 10 years later when they start noticing changes in your labs and the TSH is finally going out of whack. So for many of you, have probably had symptoms for many years and issues for many years, and they've just been medicating and medicating and tell you to eat less and exercise more, which really doesn't work. So finally, one day you go to your doctor and they look and they say, well, what do you know? Your TSH is high. And that means that you have primary hypothyroidism. And so finally, some of you are just so relieved that you got that diagnosis, not because you want to have a disease, but maybe you're going to get some answers, right? So your TSH is high, you have hypothyroidism, and what you need to do is take thyroid hormones, right? Which different ones are synthroid, levothyroxine, nature-thyroid, armor thyroid. These are basically thyroid hormones. Actually, they're better termed thyroid replacement hormones. And really, how long do you have to take these thyroid hormones? Can we all say at the same time? For the rest of your life, right? So you put on these thyroid hormones, and most of you are like, awesome, you know, I'm glad there's a solution. I have been having a problem for years. I'm glad there's a solution. I'm just going to take these hormones and I should lose some weight. I should get my energy back. My mood should stabilize. My constipation should go away. I should just feel better, okay? So your doctor gives you that prescription, right? You go off to the pharmacy, happy. You can't wait to get this drug, and you're going to start feeling better. And so they tell you, come back in about 2 months and we'll check to see how you're doing. So typically after 2 months, one of two things happen. Either you feel okay, but most of the time you don't feel okay. But even if you don't feel okay, your labs come back normal. And you're like, I feel like crud, but you're telling my thyroid is normal? And they say, well, you know, the labs are normal. Let's just give it some more time, see if things start to settle. Come back in a few months. You're like, okay. Or maybe your labs are not normal. And so they have to mess with that drug and adjust it, so they can get that medication right where they want it. But for most of you, even when they get that medication right where they want it, you still feel like crap. You still have no energy. You still can't lose weight. You still can't think straight. You still have bowel issues. You're still losing your hair. You're still feeling anxious. You're still feeling depressed, right? And so what happens is, well, they say, hey, your thyroid is normal. It's got to be something else, right? And so once you get that TSH dialed in, you start becoming medicated for depression now, or with an antidepressant, or you start getting diagnosed with anxiety. Now you're on anti-anxiety medication. Well, now you have constipation, so they put you on a stool softener. And what happens is you just start getting medicated for every symptom that pops up. And so this continues to go on and on, right? It goes on and on. It's not usual for me to see a patient who has gone through this, and then all of a sudden they start going through menopause, and oh my God, it's menopause. And now what they're having is type 2 diabetes. And now they're on medications for blood sugar medications and metformin and glipizide, maybe insulin. Oh, now you've got blood pressure. Now you have cholesterol drugs. So the medications start to just pile on and pile on and pile on. And all the while, you've never felt good the whole time. And when you don't feel good, right, it's difficult to do the things that you need to do, whether you're a mom, whether you're a dad, whether you're an employee, a boss, a grandmother, whatever you are, it's hard to come to the table 100% when you have no patience, when you feel terrible, and the thing is, and what happens is your relationships start to suffer because oftentimes spouses are fixers and they don't know what's wrong with you. So it can really drive a wedge in the relationships with family, with your spouse. So really understanding the story is tragic, but it doesn't have to happen. Now, some of the most frustrating things that this whole thyroid debacle is when you go to the doctor and you tell them, you know what, I'm tired, I can't lose weight, I don't feel good, my hair's falling out. It doesn't take a rocket scientist to say, well, sounds like your thyroid. So what happens is, generally, when you go to the doctor, they run one marker. It's called TSH, okay? It's a thyroid marker. And so what happens, they run this and they say, oh, your thyroid's high. And you know what? That's it. That's all they run. But did you know that there's over 11 different markers that really determine how your thyroid is functioning? Yeah, and they're testing just one. So when you go run this TSH, it stands for thyroid stimulating hormone, and it actually comes from the pituitary gland. And when they see that high, they consider that you have primary hypothyroidism, and that's it. There's no other searching, there's no other discovery. They don't look any further. Did you know that there's over 40 different markers or 40 different patterns that could go wrong with your thyroid? 40. And they're only looking for one pattern. Why do you think that is? It's because that's what they have the solution for. So if you have high TSH, you put on thyroid hormone, but if you have any of the other imbalances, you have anything that's going on underneath the surface, that drug, that TSH or that thyroid hormone doesn't fix any of those. And so what happens is they just don't go any further because it's not going to change their treatment, and they don't look any further. And so what happens? The symptoms just start piling on. The other thing that's absolutely crazy to me is that many of you sitting on this webinar today, you actually have an underlying condition that's really not even being checked for, okay? Most of you are not even being checked for this. And this is the thing. It's actually an autoimmune condition called Hashimoto's, okay? Now, if you've never heard of Hashimoto's, right? If you've never heard of it and you think to yourself, well, if 90% of us have this autoimmune condition causing a problem with our thyroid, why are they not checking me for this? The answer is this. If you have Hashimoto's or you have low thyroid, the treatment to them is exactly the same. It doesn't change their treatment. So even if you run the markers to determine if you have thyroid or have Hashimoto's, you go to your doctor, they run it, they're not going to change their treatment. They're just going to put you on thyroid hormone. Even if they send you to an endocrinologist, the specialist, they're still just going to give you thyroid hormone because that's the standard of care. Okay, so essentially it can help at one level, but it doesn't do anything to treat the underlying problems. So, but this is very dangerous because if you have an autoimmune problem, right, going on underneath the surface, the autoimmune system means that your body is, or autoimmune means your body is attacking the thyroid and killing it, okay? And what that really means is if you have Hashimoto's, and follow me on this, if you have Hashimoto's, it means you don't have a thyroid problem. I know you have primary hypothyroidism, right? But if you have Hashimoto's, and that's the problem, you have an autoimmune disease. That's the true problem. The thyroid is really just the victim of the autoimmune disease. It's just picking on the thyroid at this point. Now, this is a challenge because if this continues to go unchecked, right? If you have an autoimmune condition going on and it's not being checked for, this can lead to other autoimmune diseases. It could even lead to cancer. So you really have to understand, where is this low thyroid coming from? Why do I have a thyroid problem? And what can I do to address the underlying causes? So we really need to understand that most of you are being treated on the surface. When that TSH comes back high, you put on thyroid hormones, and that's the extent of the discovery process. That's the extent of really understanding what's going on. They don't really look to where it's coming from. Because when you address the actual where it's coming from, then you can really start resolving all of these symptoms that you're dealing with. Now, in traditional Western medicine, right, like I said before, there's definitely a time and place for medication. And really, I do not advocate that you stop taking your thyroid hormone because, interestingly enough, the thyroid hormone is the only hormone in the body that goes to almost every cell and tissue in your body. So it's super important. And that's why, I mean, it really goes, it can start to affect you literally from your head to your toes, okay? So, and that's why you can have those crazy symptoms all over your body. And so, but this is the thing is, if you just medicate the symptoms, then really what's happening is you're never really dealing with the underlying problem. And these symptoms just continue and continue and continue, and the medications go up and up and up. So when your body, again, is given us symptoms, it's a signal, it's a warning sign that something is not right. And if you continue to medicate your symptoms to push that symptom down, well, another one pops up, okay? I have five grown kids, and I have 5 grandkids. And when my kids were growing up, they loved to play that game whack-a-mole, you know, and the mole would pop up and you'd whack that and pop up and whack it down. It was fun. Well, if we're kind of doing the same thing, is when we have a symptom, what we're doing is taking a drug to whack that symptom down. Then another symptom pops up and we whack that down. Then another symptom pops up and we whack that down. And then sooner or later, the drugs that you're taking are creating symptoms that you need drugs to create, to take those symptoms away. And what happens is you just start taking more and more drugs and you feel like there's a war going on inside your body and you don't know what to do, right? And then really, neither does anybody around you. So let's talk about how do we get out of this situation, right? How do we break through this? How do we start to resolve the symptoms that you've probably been struggling with for so many years? And I want to give you the shortened version because I typically do these webinars or seminars live, and I spend about an hour to an hour and a half going through it. So my job really is just to give you enough information to help you move forward in the right direction. So when we're looking at hypothyroid disease, you have to understand that the root cause, right? The root cause for most of you is really an autoimmune issue, okay? So 90% of you, and this is the crazy thing, 90% of you are likely to have some type of underlying autoimmune disease. That's what's happening on. And it's not really being addressed. So for some of you, you've been diagnosed with Hashimoto's, right? But you're still on the same medications as those people who have not. And so essentially, when you give the body thyroid hormone, it helps on one level, keeping the thyroid hormones balanced, okay? But it does nothing to deal with anything that's going on underneath the surface. So TSH can help you on one level, but it's really very superficial. And that's why people can get their TSH balanced, but they're still having all those symptoms. And what I want to do is I want to go through, I want to get back on and go over and share my screen with you again. Okay, let's share my screen with you one more time. All right, and let's go. All right. Okay, good. So most of you have a decrease in your thyroid hormone. So when your thyroid hormone goes down, TSH goes up. And when TSH goes up, your doctor will give you some form of T4, T3 combination to help balance out TSH. And after that, that's it. So again, it helps on one level, but it does nothing else for the things that are going on underneath the surface, because most of you, what you have going on is an immune issue. So your immune system is attacking your thyroid, slowly killing it, so it can't produce thyroid hormone, which the thyroid hormone goes down, causes TSH to go up, and then they give you replacement hormones, but it's still attacking your thyroid. That's what's happening. The immune system is attacking it. So what happens? What creates the immune system and causes problems with the immune system? Well, the first thing is this. If you're having issues with insulin surges, this is a big deal. Anytime you eat cakes, cookies, ice creams, sugar, any of those products, it causes a sugar spike, which causes an insulin spike. And what that does is it causes a surge, which aggravates your immune system. This is what we call a bidirectional feed-forward mechanism. So what it does is once it starts, this process starts spinning, and you can't get out of this situation. So whatever you eat next, it's going to cause another insulin surge. No matter what you eat, causes an insulin surge, which causes another immune response, which causes another insulin surge. So it sits here and spins and spins and spins. Well, if you keep on having more and more insulin surges, what happens? You develop diabetes. So if you're having insulin surges, you can't lose weight. Insulin is a fat storing hormone. So if you keep on surging and surging, well, it leads to insulin resistance and diabetes. The most common thing that we see with postmenopausal females after they have, hypothyroidism is they develop diabetes. It is like the most common thing we see. So it's scary to hear that, especially if you have a family history of diabetes. It just tells you it's coming. So anyway, insulin surges aggravates the immune system, causing the body to spin out of control, okay? The next thing is the adrenal glands. So the adrenal glands are these small glands that sit on top of your kidneys, and their job is to regulate blood sugar. Their job is to help you with brain function. They help you with stress. A lot of women have problems with brain fog. They just don't think clear. They can't think clearly. They forget things. This has to do with hypothyroidism. You're not having dementia, or most likely not having dementia. It also regulates your hormones. One of the things that happens is that, especially as you go through menopause, in the United States, we've made menopause a disease, and it's not a disease. If you were to ask your great grandma, what was going through menopause like, she would have probably looked at you like you're crazy. Like, what do you mean? What was it like? Because the way she realized that she went through menopause is she just stopped having periods. That was it. No more periods. I guess I went through the change of life. She didn't have this, irritability, this fluctuation in moods, this, hot flashes. The reason for that oftentimes is you have an overstressed adrenal gland, and your adrenal gland takes over the production of hormones and the transfer from being childbearing to non-childbearing years. So if you're having those symptoms, there's a good chance you're having adrenal gland issues. If you're having sleep issues, you can't sleep. You wake up in the middle of the night and can't go back to sleep. If you can't get to sleep at night, you're falling asleep at 1, 2, or 3 in the morning, you have adrenal gland issues. And those things will cause insulin surges, which will cause an immune issue. So that's another trigger. The next thing is hormones. Now, it's important that you realize that hormone fluctuations are a big deal. We talked a little bit about the change of life, but there's also, if you start your menstrual cycle as a change, that's why you can have that trigger. Also, if you start taking birth control, you can start going through this because you're having to metabolize those hormones. Or if you're pre-diabetic and you have polycystic ovarian syndrome and you're having testosterone surges, women can have that. They can get hair on their face. This can aggravate your immune system as well. So this can cause and be a trigger to your immune system and set it off to start attacking your thyroid. Another thing is infections. I would say probably 8 out of 10 people on this webinar have a problem with some type of hidden or subclinical infection. Now you think, I don't have a fever. I don't feel a problem. I know that. Your body is so infatuated with your thyroid and it's so overstressed that it's not even paying attention to things that are going on in your gut. And it is not uncommon to see bacterial infections, viral infections, yeast infections, mold or biotoxins are very common. So, but your body doesn't recognize it because it's too busy fighting on the front of your thyroid. So these type of infections are just subclinical. You just don't know, but they can really drag you down. It just makes your energy feel tired all the time. Another thing is digestion. And I would say here with you, most of you on here probably have some issue with digestive issues, right? And I would tell you that what happens is, you have bouts of constipation where you just can't go potty for days. I had some people that can't go, for 7, sometimes 10 days. They'll have a bowel movement, which is really bad. I have people who come in with alternating bouts of constipation and diarrhea, and they think, okay, man, there's got to be some type of food that I'm eating that's creating it. So you're looking for different foods. Maybe I have an allergy, maybe a sensitivity. But I can tell you, these can set your immune system off as well. Digestive issues, leaky gut, dysbiosis, all these big terms, but it just tells you your gut's not right. Heartburn, Helicobacter pylori. So what happens, we have to really dig deep into these things if you really want to find out what's causing this, because most of you have issues like this. So if you're still suffering with symptoms of low thyroid, and even though your labs are normal, that there may be these other things that are underneath the surface that are going on that no one is really looking for or looking into, okay? But this is the thing. If it was truly a thyroid problem, and it was just that your thyroid was too low and that was the problem, then as soon as you added thyroid back into your system, all your symptoms would have went away. You would have felt fine. You would have lost weight. You would have, got your hair growing again. You would not have all these other issues. And that's what you have to understand. But if you're still having all these symptoms and your thyroid levels are normal, there's something else going wrong. There's something else going wrong. So we have to continue to look. We have to continue to investigate and figure out where are these symptoms and these problems are coming from, because what we have to do is really figure out what all those triggers are for you. What are the triggers that are creating your problem? But this is the thing that you have to understand. If you don't handle this, you're at risk of developing other autoimmune diseases. The studies say every 10 years, you typically get a new autoimmune condition every 10 years. That's what they says. And what happens, you could also develop thyroid cancer. So the most important thing is you have to get the immune system under control. And if you don't handle these triggers and you don't get these under control, you're at risk for other autoimmune diseases. I'll give you an example. My wife's mother, my mother-in-law, she had a thyroid problem where she had gained weight and lost weight and gained weight and lost weight. Then she started developing this big growth, a goiter, found out it was cancerous. She had Hashimoto's, and it turned into a cancerous situation. So they had to remove it, okay? Another one of my patients, she was diagnosed with Hashimoto's in her mid-40s. When she turned in her 50s, she got ulcerative colitis, where it starts to eat your large intestines. And then 65 is when I met her, and she had just gotten RA, rheumatoid arthritis. At that time, just a few months prior, she had her colon removed because the autoimmune disease had eaten the colon so bad that her stool was sifting into her abdomen and creating sepsis. So this is the key. And I think if I can get across to most of you, it's not just about the symptoms, but it's about getting the symptoms under control, but not allowing this crazy overzealous immune system from attacking more and more things. Okay, let me stop sharing this. All right. So the most important thing is really to uncover the imbalances, the triggers. And listen, they're just not the same for every person. Each person has different issues. So what happens is what we do get stuck with this hypothyroid label. And when we go to the doctor, they treat you as a hypothyroid patient. They treat the disease, they don't treat you. And so you go there, they check off this box, and maybe they add some other diagnosis or maybe some other labels. But this is the thing, they just treat the disease. But we can no longer treat the disease. We have to treat you as a person who has imbalances, who has challenges. Again, each person has different triggers, and we have to really figure out and do our due diligence, do the appropriate testing to reveal to us where those individual imbalances are and what we need to do to really help them get better. And then what we have to do is develop a plan so that you're not in constant contact with these triggers and causing your immune system to go spinning out of control. When we do that, then the symptoms start to go away. We start to lose weight without these crazy diets or starving ourselves. And I know that there are a lot of people out there that eat less and less and less and are gaining more and more weight, and it's just not right. But this is the way it is. I have patients ask me all the time, they say, Doc, can I eat broccoli or can I eat cauliflower? And I'm here to tell you that there's not one diet for a hypothyroid patient, okay? There's not one diet for diabetics. You have to look at the individual person. You have to understand how their body responds to foods and how their body responds to sugars and how they respond to certain things in their gut. And we have to customize a diet. We have to customize a program for you. We got to customize an exercise program. So when we stop treating the diagnosis, we have to stop treating the diagnosis, and we have to look at patients as individuals who have imbalances. That's what we have to do. And then when we do that, it allows us to understand, like, where are these imbalances and what needs to be fixed so that we can actually move the needle in the right direction. So I think the most important thing that everybody has to understand is that your body really is born to heal. There is nothing hopeless out there. You are not hopeless. You can turn around. And sometimes we get into this point where we're hopeless, but I want to give you just hope that you can turn this around, that this is not your destiny, okay? This is what this is all, here's what this is all about. Now, it's important for me to get this information out to as many people as possible because there are millions and millions of females out there that are suffering from the same things that my wife did and just don't know what to do. Okay, so part of my mission is really just to get the information out because You just don't have to stay here. You don't. Second, I wanted to give as many people as possible access to this type of healthcare. It's important to me to start changing the face of healthcare. So meaning this, that you're not treating symptoms with medication, but you're actually looking for the underlying causes and working at the root cause rather than just treating symptoms for the rest of your life. And so now what I have done is this, is I've created an opportunity for some of you, but not all of you, okay? There are over 30 people on this program, okay? And so with that being said, I wanna offer to some of you, not all of you, I've set aside, I have 13 available 30-minute free consultations to see if what I do would be right for you. These consultations are only good during this webinar, okay? And you need to take advantage of it during the webinar. So let's talk about like, who is it for, who is it not for, okay? These consultation spots. If you're somebody who is frustrated, tired, annoyed, and no longer willing to put up with these symptoms, and this would probably be a good opportunity for you. Also, if you're somebody where your health is your #1 priority, and I'm going to say that, your health is your #1 priority, and let me clarify that for you. If you're a mom, if you're a grandma, if you're a boss, you're an employee, a business owner, whatever, especially if you're a female, you have probably been raised with the idea that everybody in your life comes before you, your husband, your kids, your grandkids, your parents, everybody comes ahead of you. And if there's something left, possibly something left, maybe at that point, you would take care of yourself. But if I can impart anything on you today, is that needs to be flip-flopped. Because if you're going to be the best mom, the best grandma, the best daughter, the best daughter-in-law, you have to put yourself first. And I say, I don't want it to come off the wrong way, but if you don't, you're coming to the table less of a person than you actually could be, as if you felt better, if you had energy, if you had more patience, if you could think clearer, you could be a better person in life. And so you have to make your health your #1 priority. And if you do this, everything will fall in line. Everything will fall in line. And I think whenever I see patients come in and they're in their 50s and 60s and they've worked their life to retire, and the thing is they can barely function, their hair is falling out, they have no energy, they have nothing to look forward to because they don't feel good. And you work your whole life to retire, right? You work your life to enjoy your golden ages. And this is what happens, is you just don't have it left. You have nothing left. And you got to retirement, and again, you have no energy, you have nothing. So you have to put yourself first. You have to move the priority of your health to the #1 spot. And if you do, again, everything else will fall in line. If you can honestly say your health is your #1 priority, then this opportunity is likely for you. If you're at a point where you say, I am no longer going to accept these symptoms, I am bad enough the way I am now, and I need to change and I want to get better, this is probably for you, okay? Now, who is this not for? If you're a person who is somebody that would, don't think that you have a major problem, right? Your symptoms are not that bad, I get it. You think you're fine. If you thought about living with these symptoms for the rest of your life and you thought, that's not that big of a deal, then this opportunity is likely not for you. If you're okay, minimizing the symptoms or, just kind of ignoring and pushing your way through life, this is not probably going to be for you, okay? Now, I've set aside 13 free 30-minute consultations to meet with me, and we're going to do these via Zoom. Okay, during that time, I'm going to go through your health history. I'm going to go and understand what you've been going through. I'm going to, listen to your story, hear all your symptoms. And at the end, what I'm going to do is just make it a determination whether I think that you'd be a good fit to move on to the next step. Okay, then what will happen is, I just want to tell you that I don't accept every patient. Okay, I don't, because there's only one of me, and I want to make sure that I only take cases that I know that I can help. Okay. Second, I just want to make sure that I have the time available. So we are getting, it's fortunate and unfortunate, but we're getting very busy. And so I just want to make sure I have time. So I have these 13 set aside. This is all I can do. Now, if you fell into the category of, yeah, this is right for me. I mean, I want to take advantage of this consultation. I want to get better. All you have to do is raise your hand, like we did at the very beginning. You just raise your hand, and my staff will come to you, and they will schedule you for an appointment to meet with me through the chat box, okay? Now, it's a first come, first served basis. Again, I only have 13 spots available. So you're gonna wanna raise your hand. They will come to you and get you scheduled during the chat, okay? Now, don't worry when they're scheduling you. This is all done in a private, no one can see that you're raising your hand. No one can see your information. No one can see anything. It's just done private between you and my staff member. So it's not public. So you can feel comfortable that this is happening again in a private section. Now, I already told you that I'm only taking 13 new consultation spots because my schedule is getting overfilled. With that being said, I only take 5 new thyroid patients a month. That's it. So you're going to want to take advantage of one of these spots to see if you could get into that, okay? The consultation is really the first step for me to evaluate whether I think that you would be a good fit for this type of care or not. So many people actually come to me and they say, so how do I become a patient? The first step is to schedule a consultation. And again, during that time, I'm gonna walk through your health history. I'm gonna go through all your medications, listen to your story. And again, at the end, I'm gonna make a determination whether I think, again, you'd be a good fit to move on again to the next step. So when you schedule this consultation, when you schedule it for, please make sure that you're in a quiet place, that you can dedicate your attention, 100% of your attention to your health. Please don't be driving down the road. Please not be in some lobby, you know, somewhere at your home or in a car where it's private, so that you can speak freely about your care. Because I want you to know, I'm going to give you 100% of my attention during that time. And I hope that you would take your care equally as serious, okay? Now, after you schedule that consultation, you're going to get a confirmation email from my staff, which they're going to give you a link to set up your profile on our online telehealth platform. Now, you're going to fill out the information, your health history completely, because when we get together, I want to make sure we hit the ground running, okay? Now, if you don't have your information filled out at least one day before the consultation, sadly, I'm going to have to cancel that appointment. And I have people who get surprised, but if it's not filled out, we just move on to the next person. So please, if you want to meet, please get that filled out at least a day ahead of time. Okay, so make sure you're looking for that email, make sure you fill out all that necessary information so that we can get together and again, we can get started right away. Oh, also, if you're on a phone, right, and you can't use the chat box and you can't use the chat box, you can't raise your hand, but you want an appointment, you can call our office. And let me give you that number. The number is 626-914-1805. That's 626-914-1805. You can call that number and then the staff will call you. If they can answer, they're probably not to. We have a lot of people scheduling, but you can leave your name, your phone number. They'll call you back to get you scheduled. Also, if you have a difficult time, you know, working through the chat box and you can't do it online, it's just cumbersome, you can call that number. They will help you as well. Okay, so again, the number is 626-914-1805, and I think it'll probably be in the chat box as well, okay? Now at this point, what I'm gonna do is move to the question and answer, and it looks like I have some questions and answers. So let's go ahead and get that started, okay? So I'm gonna change over here, so bear with me for a second. Oh, let me get out of this. All right, Q&A. Okay, good, and close that down. All right, okay, I am going to close that. Good, okay, where are you guys? I hope I'm still here. Can you see me? I hope you can. All right, I am going. All right, first, okay, good. I have a couple questions here. Okay, it says Brandalee, Dr. Hannon, is thyroid dysfunction relative to only internal factors or external environmental, or can it be environmental? Good question, Brenda Lee. So the thyroid problems or Hashimoto's, it can be both. It can be one, it could be other, it could be a combination of the two. So when you say internal, meaning do I eat poorly? Do I have, bad stuff in me that's creating the thyroid problem? Yeah, that could be part of it. Or could it be external? Could it be mold in your home? Could it be that you have mercury? You can't get rid of mercury out of your system, or cadmium, any of the heavy metals. It could be that as well. For example, I had a lady who came in to see me, and she was having headaches for the last 2 years. Every day, she's had CAT scans, she's done everything. The doctor said, we can't find anything wrong with you. She's fine. Well, she had a thyroid problem, but she didn't know she had Hashimoto's. Well, we did our testing. We accepted her as a patient. We did a thing to determine if she had some environmental problems. We found out that she had mold, and she also had mercury problems. So we put her on a protocol to fix those. And within 2 weeks, her headaches went away. She started dropping weight, like 2 pounds a week, okay? Her energy went from, on a scale from 1 to 10, 10 being great energy, she was at a 2, and in 2 weeks, she went up to a 4. 4 weeks later, she was at a 6. Her energy started going up, and what she had was a biotoxin. So yeah, it can be external, but she also had other issues going on internal, okay? So I hope that answers your question, okay? Dr. Hannon, what series of tests do you run for Hashimoto's? Already diagnosed with autoimmune disease. Thank you. Okay, so Brenda Lee, what happens is that there are certain markers that are done for Hashimoto's. The typical one is TPO antibodies, and the other one is antithyroglobulin antibodies. Those are the two markers. And those markers say, do you have antibodies against your thyroid, or do you have Hashimoto's disease? Now, if you have other autoimmune problems, rheumatoid arthritis, psoriatic arthritis, multiple sclerosis, Reiter syndrome, ulcerative colitis, well, that means you already have an immune problem. Now, you're likely, if you have a thyroid hypothyroidism, you likely have Hashimoto's, okay? And it's just the next area that's going to be attacked. But if you have an autoimmune problem, well, that's what we're really talking about. If you just had hypothyroidism and that was it, well, there's nothing really we can do, but you have other problems and triggers that are setting things off. So the thing is, if you go, and a lot of people go, well, I'll just go to my doctor and get it diagnosed. That's great, go for it. But when it comes back and says you have Hashimoto's, and you ask the doctor, what are we gonna do about it? They'll say, well, are you on Synthroid? Yeah, well, that's all we're gonna do. But I have an autoimmune problem. Yeah, that's about it. You know what? If it gets bad enough, they put you on some bioactive stuff, put you on things where they put chemicals every month into your system for like rheumatoid arthritis, which are sometimes pretty harsh drugs. But what I'm talking about is you can actually get your immune system to calm down naturally if you find out what the triggers are, okay? So there you go. All right. Any other questions? All right, Rosa. What tests can be done to check for autoimmune? What test is needed to check for the adrenal glands? So we just talked about the immune with TPO antibodies, Rosa, and antithyroglobulin antibodies. But again, you can go and look at the test, but even if you're found to have it, your doctor will not be doing anything about it because they don't work with those type of problems. They could put you on, like one of my good friends, when she got ulcerative colitis, the doctor prescribed prednisone, and they told her she was going to be on prednisone for the rest of your life. And when she went to the pharmacist looked at her and said, you know, you're going to get this big round face, you're going to get this buffalo hump from being on this drug. She goes, no, I wasn't told that. Yeah, that's what's going to happen. And she's like, I don't want that. So she recommended 20 years ago that she look for some type of natural way of doing things. And recently we found out with her, she's sensitive to chocolate and almonds and eggs, and now she's improving, and now she's at her ideal weight. She looks great. So yeah. Okay, Rosa asks, what insurances do you accept? Rosa, we work with all insurances. What they cover, we don't know. But if you're interested in that, all we have to do is fill out the paperwork. You fill out the paperwork, you fill out an insurance form, and what we'll do is a complimentary insurance benefits check for you to see what they will cover or what they won't cover, okay? It says, Desiree, my thyroid was removed due to cancer. Can I still get help? Sure. So Desiree, if your thyroid was removed, you're on thyroid hormone, but you're still having every symptom under the sun, you still can't lose weight, you're still tired, you're still having anxiety, depression, your hair is falling out, whatever. If you're still having all those symptoms, then yes, you can be helped, okay? Because those are symptoms of problems underneath the surface. They took out your thyroid, and thank God, if you had cancer, they removed it, thank God, because you're here, right? But they're not getting to the underlying causes, the root causes. They're not checking that out. And that's what we do. And so, yeah, I have had many people who have had their thyroid killed with radioactive isotopes, or they've had it surgically removed, and they were on thyroid hormone, had every symptom under the sun. And after we got done working with it and found their triggers, they went back to feeling really close to normal. They felt good. They were able to think clearer again. Okay, good. Jenny. All right, what tests do my doctor run? Besides, well, Jenny, there are lots of different tests that your doctor could run to check your thyroid out. But the problem with this, Jenny, is this. They can spend the money to do the tests, but they won't do anything about it. Meaning they can test this and this, they can test your T4 and T3 and free T4 and combined T4. You can run every test under the sun. The treatment will never change. It's always Synthroid, levothyroxine, cytomel, Armour, and that's it. If your TSH is balanced, they don't really care any further. But if your TSH is balanced and you have all the symptoms, well, they're not looking to see if you're an underconverter, an overconverter. They're not checking to see if you have high reverse T3, T4. They're not checking to see if your liver is underconverting. They're not checking to see if your gut is not working right. They're not looking for those things. That's what I do. So you can have them run any tests and you can ask them, it's just not going to change anything. And that sounds sad, but it's the truth. Okay. Do you know anything about brain encephalitis? Okay. It's like brain encephalitis that can be offshoot of Hashimoto's. I read it somewhere, but I do not know how to spell encephalitis. Okay. So yes, Linda, so encephalitis. So this is the thing that you have to understand. If you have Hashimoto's, right, it's a label. The problem is you have an overzealous immune system. The overzealous immune system is finding things to pick on. It's a bully. It's attacking your thyroid. Now it's going to attack your gut. Now it's going to attack your brain. Now it's going to attack your adrenal glands. It's just attacking things willy-nilly. And if it attacks your brain, you can get multiple sclerosis. But it could also send off what we call a prionic cascade inside your brain and cause your brain to start to shrivel or shrink up and cause inflammation. There was a movie recently out, Brain on Fire. It's similar. It's an autoimmune issue. It's setting it off. Now, this is the key. You have to find out what's triggering, what's creating all these things underneath the surface. If you don't find out what's triggering it, then what will happen is you will constantly trigger your immune system on and off throughout your lifetime, and now it's it's attacking this, and now it's attacking that. So no one is digging deep, and your doctor doesn't have time to go and look for all this stuff because they're too busy, prescribing drugs, and people come in and this is not what they do. That's what I do. But we can figure out those things. And if you're having issues with your brain, Linda, there are tests that we can do to figure stuff out with that. Okay, good. I love all these questions. Kathleen, I've had hypothyroid for years. My daughter has been diagnosed with Crohn's disease. Is it hereditary? Yes, it is. So autoimmune diseases are genetic. They are passed down from one generation to the next. It attacks whatever your body decides to attack. So my wife's mom, my wife's grandma, they all have thyroid issues. My daughter has thyroid issues, okay? My granddaughters will probably have thyroid or some type of autoimmune disease unless we start changing their habits and their lifestyle now to figure out what their triggers are. Because if you figure out ahead of time, then you can hopefully keep that immune system from getting excited. So yes, if your daughter has it, it's probably passed down. Now, just because it's genetic does not mean that you can't get resolution of symptoms. It just means that you can get it. You can still resolve the symptoms because this is the thing that you have to understand. Genetics are like the hardwire. But the soft wiring or the software is called epigenetics. It means it's above genetics. There are switches that turn on genes and turn off genes. If you change a person's environment, you can change the way a gene is expressed. That's how a person can get better. So I don't care if everybody through your whole line had thyroid problems or everybody through your line had diabetes. You can turn those things around if you turn off the switches. You just got to find out what the switches are and turn them off. Okay? Doctors don't look at this detail. They just don't. They don't have the time for this. Okay? All right, let's go on. Ooh, Lynette, let me see if I can read this. 2.5 years ago, I weaned off 30 years of anti-anxiety meds. Since then, I have followed up strict organic paleo diet, lost 110 pounds, and seen some improvement with my anxiety. I still have early AM severe anxiety, okay, digestive issues, some depression. What more can I do? My doctor says I have a sluggish thyroid. So Lynette, all I can say is that you have all these other symptoms, and I'm glad that you're able to wean yourself off. The majority of neurotransmitters are produced in your gut. And if you have underlying infections in your gut, you have dysbiosis, it can create problems with your brain. So everybody says, what do you think? What's your gut tell you? Your gut tells you, it talks to your brain. So if your gut's not right, your brain's not going to be right. So you have to figure out what all these triggers are. And if you can figure out what the triggers are, Lynette, with proper testing, I don't know what your testing would need, but proper testing, then you can start to adapt your life more to get rid of and maybe lose more weight and get yourself feeling even better, okay? But I don't know exactly what you would need. Kathleen, apologize for my typos, no problem at all. What does high reverse T3, I don't have time, Patricia, to go into it in this test. You know, I don't have really time to go into all the mechanics of the thyroid, reverse T3, combined T4, free T4, all that. I don't have time to really, but what it does tell you is reverse T3 just generally is like the brake. It can slow down thyroid. Your body converts it into reverse T3, which is inactive as opposed to active thyroid. And so it's kind of too much to go into here. And I wish I could give you more time, but I just don't have the time to go through it right now, okay? But all right, let's see. And synthroid cause osteoporosis. Honestly, I would have you read the drug and see on the back. I've not heard that to be true, but I've heard that osteoporosis can be an overzealous immune system attacking and eating bone, just like if it's eating your thyroid or just eating your adrenal glands, it could be that as well. So I've heard that be said. I can't prove that. Okay. And let's see here. Woo! Okay, Dr. How can I stop the overstimulation of inflammation triggering my entire body? Can autoimmune be environmental? I was born near an undisclosed nuclear. Well, randomly, I don't know if that's to be true or not. I don't know if that's what's causing your thyroid. I can't tell you that. All I can tell you is that it's hard to do it and tell you all your answers on here, Brenda Lee. The best thing to do is have a consultation spot. Let's sit down and talk about you, or I can spend 20, 30 minutes talking to you about your situation, and then we can go forward with it. That's the only way I can really give you more information. It's too much to do on a venue like this, okay? High levels of parathyroid hormone cause your osteoporosis. I have not heard that to be true. Parathyroid hormone is right behind your thyroid. It is very important with calcium balance. When you do have too much calcium in the blood and you have an overactive or you have the immune system eating your thyroid, it can possibly start attacking your parathyroid as well. So that's one of the things you want to calm that immune system down so it's not just attacking your thyroid, it can attack the parathyroid as well, okay? If it's eating one thing and it eat another, they're right next to each other. All right. Good. All right, I'm getting down to the last few here. Thank you. Let's see. Good. What's the last one here? Good. What is your background in medicine? Okay, so Bonnie asked, what's my background in medicine? My background in medicine. I have my doctorate as a doctor of chiropractic, but I have a gajillion hours in postgraduate doctorate education in functional endocrinology and clinical nutrition. Basically, this is what I do all my life. This is what I've been doing, just helping people find the root cause. The nice thing about being a doctor of chiropractic, is our philosophy believes that the body has an innate ability to heal itself if it's not interfered with. So if you're in a traditional model, you have to give medication. That's the only thing that they can do. And if you do anything outside of that, you can be sanctioned, you can be treated, you can be ostracized because you're going outside the model. As a doctor of chiropractic, I'm already outside of the model. I'm already looked at as a bastard child of medicine. So that's okay. But what I do is work with the body to get better. And what we have seen are people just their lives are turned around. I had people who had myasthenia gravis, couldn't move their joints. They had fibromyalgia. They have all these different weird and wonderful diseases. And now they're turning around and getting somewhere. Instead of just being on drugs and covering up symptoms, they're getting their health. Okay? So, all right. I think that's it. All right. Well, hey, I hope that you enjoyed the talk today. I hope that you got something out of it. For those people who made an appointment, I'm excited to meet you. For those who didn't, I hope, again, you heard something. I hope the question and answer helped you out. And have a great day. All right? Thanks.